Millions of people take aspirin with the idea and hope that it would prevent them from having a deadly heart attack or a debilitating stroke. But aspirin may not be beneficial to you. In fact, it could be harmful for you in some of the cases. In today's video, we'll discuss about who should take aspirin, who should consider taking aspirin, and who should avoid it altogether. So, before we can dig into the topic, let us discuss the role of aspirin in various scenarios through a patient's case history. This is a patient who came to me who is a Mr. Paul, who is a 50-year-old gentleman who had a heart attack 5 years before, and for that he had an angioplasty and stenting done. So he came to me and he asked me that he is on aspirin for the last 5 years, whether he should continue aspirin, and if he has to continue aspirin, for how long he has to continue aspirin. That is scenario number one. In second scenario, Mr. Paul also brings along his brother, who is a 40-year-old gentleman who is having diabetes, as well as he is a smoker, he is a hypertensive and high cholesterol. He is asymptomatic, he doesn't have any problem. So he asked me, since his brother also had a heart attack at the age of 50, whether he should take aspirin as for the prevention of heart attack. That is scenario number 2. And scenario number 3 is in case of Mr. Paul's father, who is a 70-year-old gentleman who doesn't have any risk factor, who is not a diabetic, neither a smoker, he is healthy, he is asymptomatic. And once again, Mr. Paul asked whether his father needs to take aspirin to prevent a heart attack. So let us discuss about all those aspects so that we understand for whom aspirin is absolutely must, for whom aspirin can be considered, and for whom aspirin should be avoided altogether. So if you haven't subscribed to our channel, kindly subscribe and hit the bell icon. As a cardiologist, I bring along every week practical health related tips which can augment your health and wellness. So regarding Mr. Paul's case, who had a heart attack 5 years before and for whom angioplasty was done and stenting was done, he needs to continue aspirin lifelong because he already had a heart attack, and for whom we are giving aspirin for a secondary prevention. What do we mean by secondary prevention? Secondary prevention means a person who already had an event, who already had a heart attack or already had a stroke, they have a higher risk of developing future heart attack and stroke. So for them, they need to be on aspirin lifelong. Apart from these two scenarios where a person already has a heart attack or already had a stroke, if a person had an angioplasty done, a stenting done, or a bypass being done, for them also aspirin needs to be continued lifelong. In this scenario, although the risk of bleeding is there, but still the benefit of continuing a lifelong aspirin is far more than any risk involved. So for them, they need to continue lifelong aspirin to prevent further heart attack or further stroke. What about Mr. Paul's brother? Mr. Paul's brother didn't have any heart related problem. He is asymptomatic. He is a relatively young person, 40-year-old, but he is having multiple risk factors for heart disease or stroke. Like he is a diabetic, he is a hypertensive, he is a smoker, he has high cholesterol, he has a sedentary lifestyle. So he asked whether he needs to take aspirin lifelong or not, or whether he has to take at all aspirin or not. The answer to that is, unlike Mr. Paul, who is taking aspirin for secondary prevention, so to prevent a further recurrence of a heart attack. But for Mr. Paul's brother, who never had a heart attack or a stroke, so he should consider aspirin for a primary prevention. So for primary prevention, that means who never had a heart attack or stroke, the benefit is much lesser. Mr. Paul, who already had a heart attack and a stenting done, the benefit of continuing aspirin is very high and the risk is low. So for him, aspirin is mandated. But for Mr. Paul's brother, who never had a stroke or a heart attack, neither had a heart surgery or stenting done, for him the benefit is not that much of continuing aspirin. On the contrary, his risk is on the higher side. So for him, actually there should not be an aspirin therapy as a blanket therapy. Like we have to discuss with the patient. We have to discuss whether he'll benefit from the aspirin therapy or not. So based on that, actually as a doctor, we treat the patient depending on that particular treatment would benefit that person or not. What is the benefit and what is the risk? If the benefit is high and the risk is low, we give the treatment. Like for Mr. Paul's case, where the benefit is high, then risk is low. But for his brother's case, the benefit is not that much. Although some benefit is there, but the risk is also there. So in that scenario, we have to take a detailed assessment, as any therapy, especially aspirin, whether it would be beneficial or not. And all our decisions are based on scientific studies. And various scientific studies were done on the uses of aspirin in various populations. Especially, it is done, the aspirin study, on a diabetic population in a study called Ascend study. As we know, diabetics have a higher risk of heart attack and stroke compared to a general population. So it is quite logical to think an aspirin which prevents a heart attack or a stroke would be beneficial if a person is diabetic. But in Arrive study, in Ascend study, it was found that in diabetics, although they have a higher risk of stroke or heart attack, aspirin, if we give it to them, although aspirin prevents first heart attack or a stroke in diabetic individuals, but the risk is also significantly high. What is the risk of aspirin therapy, chronic aspirin therapy? The risk of chronic aspirin therapy is bleeding, especially gastrointestinal bleeding or CNS bleeding. So even though a person is diabetic who has a high risk for heart attack or stroke, in those group of individuals also, we should not give aspirin to all of them. You have to assess the risk minutely and then only we should consider. So likewise, there was another study known as a Arrive study. In Arrive study, actually they have seen those patients who have multiple risk factor for heart attack or stroke, like those who are having high BP, those who are smoker, those who have high cholesterol and triglyceride, those who have a sedentary lifestyle, those who have a family history. All those multiple risk factors are there if in a person. What is the benefit of giving an aspirin for the prevention of a heart attack or a stroke? So in that study it was found, even though a person is having multiple risk factor, if we give an aspirin to prevent a first heart attack or a stroke, the benefit is not much. In fact, there is hardly any benefit, but the risk is significantly higher. So once again, if a person is having a multiple risk factor also, the aspirin therapy is not indicated. So as we can see from the chart, aspirin therapy is beneficial, but it also has a risk. So if you give an aspirin, especially for higher risk group individual, it can prevent stroke or a heart attack, but it can also cause risk, especially bleeding risk, predominantly gastrointestinal bleed like melena or a CNS bleed. So if the risk is the protection is 10% by preventing a first heart attack or stroke, the risk is more than that. The risk is up to 30%, the risk of GI bleed or a central nervous system bleed. So the risk benefit ratio doesn't favor aspirin therapy because the benefit is less, the risk is higher. So how does it get implemented in Indian context? So India, we know we have a higher risk for heart attack, premature heart disease in Indian scenario, in South Asian context. So if a person is having multiple risk factor, like a person is diabetic, person is having high triglyceride, a person is having history of smoker, premature heart disease in the family, as well as there are other risk factors like elevated lipoprotein A, or there are documented angiogram shows there is a blockage in the heart vessels or neck vessels or peripheral arteries. In those scenarios, aspirins can still be considered in younger group of individuals, especially if they have a lower risk of bleeding. So if you like our content, kindly subscribe to our channel and hit the bell icon. So what happened? What is the next scenario? The next scenario is about Mr. Paul's father, who is a 70-year-old gentleman without any symptom. He is concerned that whether he should take an aspirin to prevent a future heart attack or stroke because his son already had a heart attack. The answer to this question is, brief answer is no, because it has been shown in various studies, especially a study like Aspirin study, where they have seen the effect of aspirin in older individuals more than 70, and it was shown older group of individual, especially aged more than 60, the role of aspirin is minimal. Aspirin hardly confers any benefit. The benefit of aspirin is very minimal or negligible, but the risk of aspirin in elderly individuals are quite high. So if you have to give an aspirin to an elderly individual beyond 60 years of age without any history of heart attack or stroke or cardiac surgeries, it's preferable not to give aspirin because the risk benefit ratio doesn't favor the risk. The risk is higher, the benefit is lower. And it has been confirmed in various studies like New Zealand study, where they have seen the risk of bleeding increases significantly as the person ages. And especially if somebody is beyond 60 years of age, the risk of bleeding increases substantially irrespective of whether the person is receiving an aspirin therapy or not. But if a person is receiving an aspirin therapy along with advanced aging, the risk of bleeding increases significantly. And this bleeding risk could be from the GI tract, as we have mentioned previously, in the form of melena, or could be in the central nervous system bleed. Central nervous system bleed could be catastrophic. I have seen so many patients who are taking an aspirin, baby aspirin, thinking that it would prevent them from a future heart attack or a stroke, but it had landed them in a catastrophic, life-threatening central nervous system bleed, brain bleed. In fact, a GI bleed, a melena also may not be very trivial. Up to 3 to 5% mortality could be seen even in case of GI bleed also. So, whenever you are taking aspirin, take it with a pinch of salt. Think whether this aspirin, what you are taking, is actually required or not, because it could be more harm than good. It could be outright dangerous to you, especially if you are elderly, more than 60 years of age, especially if you have higher risk of bleeding. So who all are having higher risk of bleeding? Especially those who are elderly, those who are having low body weight, those who are having concomitant other medication, blood thinners, like those who are on anticoagulation for any reason. Some patients are on blood thinners because of other heart conditions like atrial fibrillation, or those who had a heart valve replacement, they are also on blood thinner. So if a person is already on a blood thinner, if you are receiving on top of once again an aspirin, the risk of bleeding increases substantially. So if a person is low body weight, if a person is lean and thin and frail, advanced age more than 60, patient is on blood thinner for other reasons, a patient is on painkiller for whatever reason, so all this and patient is having accelerated high grade hypertension, patient is having uncontrolled hypertension, in all those group of individuals the risk of bleeding is higher, and this group of individuals you should not give aspirin. So what is the key takeaway? The key takeaway is whether aspirin should be given to a person or not, that depends. If a person who already had a heart attack or already had a stroke should take lifelong aspirin. At the same time, if a person already had a heart surgery, be it angioplasty with stenting or a bypass, he should take a lifelong aspirin. There is no doubt about that. So aspirin lifelong for this group of individuals. But apart from that, if a person doesn't have any of the symptoms or patient is not having a prior heart surgery, no prior history of heart attack or stroke, aspirin should not be given, especially if the person is beyond 60 years of age. If a person is between 40 to 60 years of age and if he is having multiple risk factors like high triglyceride, high cholesterol, smoking, family history of premature heart disease, sedentary lifestyle, obesity, so multiple risk factors are there, and if there is evidence of a block in the coronary arteries, in those group of individuals, still aspirin could be considered, but in the age group of 40 to 60, in that age group. But beyond 60, aspirin should not be given. So if you like our content, kindly go and see our prior video which talks about if there is a heart attack at home, as a first aid measure, what you can do so that it can save your life. And thank you all for your patience here.